Hi, I'm Crystal. I'm the RN that's going to be administering your medications today. Can I get you to please state your name and your date of birth? I have you as Miss Millie Larson. Date of birth is January 1st, 1936. I'll just check your armband. Millie Larson, date of birth is January 1st, 1936. And I have you as not being allergic to any medication. Perfect, Miss Millie. Okay, so what we're going to do is I'm going to be giving you your Ducastat. It's a stool softener. It is 100 milligrams. You're going to take it by mouth. The expiration is 6 of 23. And then I also have haloperidol. Um, the I have 2 milligrams. This is 5 milligrams. So I'm going to be administering 0.4 milliliters intramuscular over here on your ventral gluteal site. Expiration on this is 6 of 29. Okay, so one more time, your name is Millie Larson. Your date of birth is January 1st of 1936. And again, Ms. Larson, I will be administering your Ducastat 100 milligrams via mouth. Expiration is 6 of 23. I will also be administering your haloperidol. It is 5 milligrams. You're only going to get 2 milligrams of it, so that's 0.4 mLs in the left ventral gluteal site, which is your the left hip. Do you have any questions for me? Perfect. Okay, so I'm going to sit you up in a high Fowler's position just so we can take your medication. I'm going to get this the Ducastat ready. Okay. All right, and then I'm going to have you take this. Very good. And here's your glass of water. Very good. Perfect. Okay, Miss Millie, now I'm going to lay your bed down flat, and then I'm going to have you turn over on your side, left hip up for me. I'm just going to prepare your haloperidol. I will take my alcohol prep pad. I will clean the rubber gasket. And I will get my drawing syringe together. And I will be using a 22 gauge by 1.5 and a 25 gauge by 5/8. I will open it and not allow anything to touch my sterile field. Get my syringe. Okay. And I will set my bottle down on the table and I will withdraw, pull up 0.4 mLs. I want to pull up the same amount that I'm going to be withdrawing. And I will go in straight to the center of the vial, and I will push my air in, and I will withdraw 0.4 mLs. We have to do a little bit more. Push the excess back in. Draw. I have 0.4, so I will pull out. Draw a little bit of air in to make sure I have my correct amount of medication. I am at 0.4. I will recap my needle. Safety protocol. Then I will label my syringe with haloperidol, 5 milligrams per ml, and my dose is going to be 2 milligrams, so I will only inject 0.4 mLs. And then I will change my needles out, not touching the sterile part of my needle. I will twist this one off and dispose of it into the receptacle. Twist this one back on. And now I will sanitize my hands. Don my gloves. Okay, and I'm going to get my Band-Aid ready. All right, and then I will get my alcohol prep pad. And I want to cleanse the area that I will be injecting. Going from the center out, not going back over the site. Then I will leave my alcohol prep pad aiming towards my injection site, which will be, I will locate the greater trochanter area, and then I want to get the iliac, anterior superior iliac spine, and then I want to locate the iliac crest, and that will put my injection site right in the center of my fingers. So now that the area is dry, I will hold the injection site tight. I'll hold it taut. I will inject my needle at 90 degrees, bevel up, flush with the skin. I will hold my syringe with my non-dominant hand and pull back to see if I have any blood return for 3 to 5 seconds. No blood return, so I will inject with my finger all of the medication. Slowly. And then I will pull the syringe straight out, push my safety plug, and dispose of my syringe. I will place a Band-Aid over the injection site. Ask my patient, how did you tolerate the injection? No bleeding noted to the site. I will remove my gloves, sanitize my hands. And then I will document on my MAR that the patient did take the Docosat 100 milligrams. I did administer the haloperidol 2 milligrams, which ended up being 0.4 milliliters. And I injected to the left ventral gluteal site. I will sign my name and initial. And I like to put in my clinical notes how the patient tolerated the injection. So I will document patient tolerated injection. Well, I will note there's no bruising or bleeding noted at this time to injection site. I will return the patient back to a semi-Fowler's position for comfort and make sure that the call light is within reach. Ms. Larson, please hit the call light should you need anything, and the nurse will be right in. Thank you.